Today's event is a meeting of two sectors that don't normally interact on a regular basis. The Central Manchester University Hospitals Foundation Trust and the Biomedical Research Centre has got together with the Corridor Connections to put an event on to look at ways of moving patient services into the 21st century with the digital and media and creative industries.
Manchester's been very much a hub of innovation, and the corridor especially is the home to a high proportion of knowledge workers.
Patient Trek was about...
We have the universities, we have the hospitals, and we have the science park and the various incubation centres from the universities.
My advice is firstly, find a strong clinical champion who will support the need for the solution, but look for management, IT and procurement champions to work with that clinical champion, because you need the support of all those groups to make an idea happen.
I have an interesting challenge, which basically is to see how pulmonary artery pressures, its pressure in the lungs, can be monitored non-invasively. It would allow us to tailor treatments based on individual patients' needs and responses. It's been a fantastic event. I've already met 3 people who have expressed a keen interest in trying to develop devices and technology which may be useful for such measurements, and I certainly look forward to working with them very soon.
I want to introduce to you today a new level of computing ability. I'm really excited to be able to tell you about a real computer that IBM's created, which can understand the meaning and context of human language. Its name is Watson. I think that the real innovation comes when care providers begin to employ analytics to mine patient data, correlate it with family histories, provide accurate risk assessments and better prediction to improve outcomes. So I really want to hear in our roundtable sessions what you think we could use Watson for.
If you go outside, you will see the names of each of the speakers, and they are their stations, as it were. So hopefully you've got a couple in mind, and we are going to run 2 rounds, so 20 minutes each, so you'll be able to join the table with one of the speakers that you particularly like to talk to.
Okay, so they do.
And is it through a computer terminal?
To the outsider, you know, the NHS is often a bit like a black box. It's really difficult to find the product opportunities, i.e. where the problems reside. And then just really trying to understand all the stakeholders and how they interact. Maybe the question for you is there an unmet need that cannot be resolved through existing processes or existing methodologies? And is that need really strong? Does the customer really want a solution?
I think what we've seen from today is a real eagerness and readiness of the business community to come to terms with and understand the NHS, and I thought the clinical presentations were fabulous.
A surgeon actually was suggesting the sorts of things that he would like to teach Watson, and that's exactly the question that I was asking, is what could we do with it?
As project director of Corridor Connections, I'm quite happy with the event today. I thought it was really good, the numbers that turned out. I thought we got a good representation across the health sector and the digital media sector, and I was very impressed by the opportunities identified by the clinicians.